The kidneys are busy organs. Their job is to clean the blood and keep it chemically balanced. Every day they filter around 200 litres of it, removing waste products and making urine. The kidneys need a steady flow of blood going in and blood and urine coming out. If this system is disrupted, the kidneys can't do their job properly and waste products build up in the body. This can happen if blood flow to the kidneys is interrupted during surgery, if we take a drug that interferes with the kidneys or with blood flow, or because of illnesses like COVID-19. We call it acute kidney injury, or AKI, and it's quite common. 1 in 5 hospital patients develop AKI, including children, although the majority of patients are older adults. Let's take a close look at a kidney. Inside there are roughly 1 million filtration structures called nephrons. In AKI, some of the nephron tubes become damaged or blocked. If the cause of the damage is dealt with quickly, the kidney can repair itself. If not, the damaged nephrons die, reducing the amount of blood the kidney can filter. The remaining nephrons grow longer to compensate, but these overgrown nephrons are not as good as a healthy kidney full of normal nephrons. When AKI is severe, patients may need to be put on a dialysis machine that takes over the kidney's cleaning job, giving the kidney time to repair itself. This is a costly and complex treatment. To avoid the need for dialysis and to stop AKI becoming a chronic condition, researchers are looking for ways to protect nephrons and stop them dying. They're testing drugs that dampen down damaging inflammation and others that stimulate tissue repair or beef up normal kidney function. To diagnose AKI, doctors usually measure the amount of a waste product called creatinine. High creatinine levels in the blood indicate that the kidneys are not filtering the blood properly. Low levels of urine also suggest a problem, but by this point, damage to nephrons has already occurred and in some cases is already severe. Doctors would like a way to catch AKI before this happens. Recently, researchers have identified new biomarkers of AKI, proteins in the urine of patients that are early indicators of kidney trouble. Testing for these could give doctors a head start on combating AKI. Even better would be to predict who is at risk from AKI and try to prevent it. To do this, researchers use an algorithm to generate a risk score for patients. If you can predict who is at high risk, for example before surgery, you can reduce the risk by closely monitoring blood pressure, avoiding certain drugs, and carefully managing body fluid levels. But developing an algorithm that works for all patients without bias is difficult. Research on AKI continues. The hope is to give doctors new tools for prevention and early diagnosis, and new drugs for fast treatment.